Hi, my name is Ashley and this is Niyat. We're doing a presentation today on invasive ductal and lobular carcinoma of the breast. Okay, so IDC is the most common form of breast cancer. It originates in the cells lining the milk ducts, and it can spread by breaking the walls of the duct, growing into nearby tissues, which it can grow to other parts of the body, such as any other organ basically, and it usually spreads by way of lymph nodes or the bloodstream. ILC is the second most common form of invasive breast cancer and originates in the breast milks producing glands or lobules, and can also metastasize to other parts of the body just the same way as IDC can. Okay, so the 4 stages of ILC and IDC. The first stage is either the tumor is no more than 2 centimeters large, or there is no tumor, but there is cancer cells found in the lymph nodes. Stage 2 is the same, where a tumor is 2 centimeters across, but the cancer has spread to nearby lymph nodes, or the tumor has grown up to 5 centimeters across with no spread to nearby lymph nodes. Stage 3, there's 3 different types of staging for 3. One is where the cancer has spread to lymph nodes above the collar. The other is if there are 10 more axillary or intraclavicular lymph nodes are found with carcinoma. And the third is 3 or more axillary lymph nodes, as well as internal mammary lymph nodes, are found with carcinoma. Stage 4, the cancer has spread to other organs of the body. Most commonly the bone, liver, lungs, or brain. It is also referred to as metastatic breast cancer. Okay, so the signs and symptoms of IDC and ILC include swelling of part or all of the breast, skin irritation, skin dimpling, which resembles an orange peel texture, having breast pain or nipple pain, having an inward turning of the nipple, having nipple discharge that is not milk, or just general redness, scaliness, thickness of the nipple or breast skin. Also, obviously, a more obvious one is finding a palpable lump in the breast or the armpit area, and just changes in appearance or texture of the breast skin overall. Okay, so the differences between the two ILC is found in about 10% of invasive breast cancers. 20% of women who have ILC have it in both breasts. It is less likely for there to be a palpable lump if you have ILC, so that means it's more difficult to find on a mammogram, and it's harder to detect. So when it is found, it's usually at advanced stages, which means poor prognosis usually most of the time, compared to IDC, which is about 80% of invasive cancers are IDC, and in this case a hard and immovable lump with irregular edges is found, and it can be detected through a variety of different screening modalities. It accounts for 90% of invasive breast cancers in men, and it is curable if detected early enough. So the risk factors that contribute to having ILC or IDC, so if your age is one of them, so the older you get, the more chance of being diagnosed with breast cancer, and especially after the age of 55. Your gender, if you're female, you have a 1 in 8 chance of having breast cancer in your lifetime. Also, if you have breast dense tissue, a family history with someone who had breast cancer, if you had an early puberty or late menopause, if you don't have children or have your first child after 35, if you're a carrier of the BRCA1 or BRCA2 gene mutations, or just lifestyle like smoking, poor nutrition, alcohol consumption, obesity are also contributing factors to your chance of having breast cancer. So the diagnosis of ILC and IDC. So diagnostic procedures used to detect ILC and IDC involves a combination of a physical breast exam, mammography, biopsy, ultrasound, and MRI. Okay, so mammography is a specific screening modality. That's the only modality licensed in Canada for screening breast cancer. And according to the Canadian Cancer Society, women between the ages of 50 and 74 should have a mammogram every 2 years. Those outside this age range will only have a mammogram if they are considered high risk.
Okay, I'll be presenting the different imaging modalities for ILC and IDC. The first one is mammography for ILC. We have two images on this slide. So both of the image findings are showing that there is a speculated ill-defined masses with asymmetric densities around those circles. The next one, we have an ultrasound. Ultrasound is not used for screening purposes, but it can be used for characterizing a lesion, whether it is solid or cystic, and it's also used to locate a lump for biopsy and measure the size of the tumor. So in this image, the yellow arrow is showing the tumor. And this one is showing an MRI of ILC. So it's showing the staging of this patient, breast cancer for ILC. So MRI has a high sensitivity in detecting ILC. It can be performed for high-risk breast screening, evaluation, staging purposes, occult breast cancer, and clinical concerning nipple discharge. So those 6 images are the different stages of cancer, how it got bigger over time. So mammography of IDC. So in this image, this is a finding of a speculated with high density mass of 14 millimeter. And this is an ultrasound of the same patient with a 14 millimeter in diameter speculated mass. It's around this area. MRI of IDC. So in this slide we have 2 images. The first one is showing a heterogeneously enhanced mass around this area, and the second one is a mammograph of the same patient, which was taken 6 months ago, and the report was negative. Treatment for IDC and ILC include 2 kinds of interventions, surgical and non-surgical. Surgical interventions include lumpectomy and mastectomy, and for the non-surgical interventions, it includes radiation therapy, chemotherapy, hormone therapy, biologic targeted therapy, and immunotherapy. The prognosis for IDC and ILC are almost similar. They have a difference of 1% or less in the survival rate. So the prognosis depends on the type of cancer, whether it is localized, regional, or distant. So when it's a localized IDC, the survival rate is 100% of 5 years, and for the ILC it's 98.9%. For regional IDC, it's 86 of 5-year survival rate, and for ILC, it's 85.7% of 5-year survival rate. And the last one is distant, when the cancer is spread all over the body, which is 28% of 5-year survival rate in IDC, and in ILC is 28.1%. So that's the end of our presentation. This last slide is our references for our PowerPoint presentation. Thank you so much. Have a good day.